If you've noticed your fingers feeling a little stiffer in the morning than they used to, if you've caught yourself avoiding the stairs you used to take without a second thought, I want you to stay with me for the next few minutes, because what I'm about to share could change how you think about your joints for the rest of your life. I'm going to walk you through 9 warning signs of arthritis that most people brush off as just getting older. Some of them have nothing to do with pain at all, and that's exactly why they get missed. One of them involves your shoes. Another involves the sound your knee makes when you stand up. And by the end of this video, I'll tell you about a patient of mine who ignored sign number 4 for almost 2 years, and what finally made her come in. My patients often tell me, "Doctor, I just assumed this was normal aging." And in my practice, I hear some version of that sentence almost every single day. Here's the truth. Some joint changes are a normal part of getting older, but others are your body sending you a signal, and the earlier you catch that signal, the more options you have. Waiting doesn't just cost you comfort, it can cost you mobility you never get back. So let's talk about why this matters so much after 60, what these signs actually are, and most importantly, what you can do about each one starting tonight. Here's something I tell every patient who sits across from me. Arthritis rarely announces itself with a single dramatic moment. It doesn't usually show up overnight. It whispers first. A little stiffness here, a little hesitation there, a small adjustment you make without even realizing you're making it, and because it whispers instead of shouts, most people don't listen until it's already been talking to them for years. That's exactly what we're going to fix today. Why your joints change the way they do. Think of a healthy joint like a hinge on a well-oiled door. There's cartilage, a smooth, cushiony layer covering the ends of your bones, and a thin fluid inside the joint that keeps everything gliding without friction. As we age, that cushioning naturally thins in places, and the fluid can become a little less plentiful. That's not a disease, that's just time. Arthritis is different. Arthritis is when that wear becomes uneven, inflamed, or accelerated, where the door doesn't just creak a little, it starts sticking, swelling, or grinding. There are more than 100 types of arthritis, but the 2 you'll hear about most after 60 are osteoarthritis, which is largely mechanical wear and tear, and rheumatoid arthritis, which is driven by the immune system attacking the joint lining. They can look similar on the surface, but they behave very differently. And that's part of why catching the early signs matters so much. The right diagnosis leads to the right treatment. Knowing which type you might be dealing with isn't something you need to figure out on your own. That's what your doctor is for. But understanding the difference helps explain why 2 people can both say, "I have arthritis," and end up on completely different treatment paths. One might need a knee brace and a strengthening program. The other might need medication that calms down an overactive immune system. Same word, very different stories. Now let's get into the 9 signs, because I promise you at least 1 or 2 of these are going to surprise you. Sign 1, morning stiffness that lingers. Almost everyone feels a little creaky when they first get out of bed. That's normal. What's not typical is stiffness that hangs around for 30 minutes or more before it loosens up. Think of it like a rusty hinge versus a stuck hinge. A rusty hinge creaks for a second and then moves freely. A stuck hinge takes real effort. You have to work it back and forth before it cooperates. If you're doing that, working it back and forth routine with your knees, hips, or hands every single morning, that's worth paying attention to. I've seen this many times in my practice. Patients tell me the stiffness fades once they're moving, so they assume it's nothing. But how long that stiffness lasts is actually one of the most useful clues doctors use to tell ordinary aging apart from inflammatory arthritis. The longer it lingers, the more it deserves a conversation with your doctor. Practical habit. Try gentle stretching or a warm shower first thing in the morning before you do anything else. Warmth increases blood flow to the joint and can shorten that stiff window. One of my patients, a retired school teacher, used to tell me she budgeted an extra 20 minutes every morning just to get moving. She thought that was normal. It wasn't until we talked through it together that she realized most of her friends were up and about within 5 minutes of waking. That gap, 20 minutes versus 5, was the clue that led us to a proper evaluation. Sign 2. A grinding or clicking sound. Have you ever stood up from a chair and heard, or even felt, a grinding sensation in your knee? Doctors call this crepitus, and it happens when roughened cartilage surfaces rub against each other instead of gliding smoothly. Picture two pieces of sandpaper sliding past one another instead of two sheets of glass. That's essentially what's happening at a microscopic level when cartilage wears thin. Occasional painless clicking isn't automatically alarming. Lots of joints make noise. But when that grinding is paired with soreness, swelling, or a feeling that the joint doesn't quite trust itself, it's often one of the earliest physical signs of osteoarthritis, sometimes showing up before X-rays even reveal much change. Here's a simple way to think about the difference. A single painless pop when you stand up is like your knuckles cracking, mildly interesting, not concerning. But a grinding sensation that happens every single time you climb stairs, especially if it comes with a feeling of the knee wanting to give way, is a pattern worth mentioning to your doctor rather than a curiosity to shrug off. Sign 3. Joints that look different than they used to. This one catches people off guard because it's not about pain at all, it's about appearance. Maybe a knuckle looks slightly enlarged. Maybe your knee looks a little swollen even when it doesn't hurt. Maybe your fingers have started to angle slightly to one side. In my practice, I've had patients tell me, "It doesn't even hurt, so I didn't think it mattered." But visible changes, bony bumps near the finger joints, subtle swelling, or joints that look asymmetrical from one side to the other can be some of the most reliable red flags we look for, because the body sometimes changes its structure before it changes how it feels. If you look down at your hands right now and something looks different from a photo of them 5 years ago, that's worth mentioning at your next appointment. I remember a patient who came in for an unrelated visit, a routine checkup, nothing to do with joints at all. As we talked, I noticed small, firm bumps near the end joints of her fingers. She'd had them for years and simply thought they were just how her hands look now. Those bumps had a name, and they told me something useful about what was happening inside her joints, even though she'd never once complained about pain. Sometimes the body tells on itself quietly, long before it raises its voice. Sign 4. Reduced range of motion. You've quietly adapted. To this is the sneaky one, the one where you don't even realize it's happening because you've unconsciously worked around it. Can you still reach behind your back to zip up a dress the way you used to? Can you kneel down to pick something off the floor without needing to hold onto furniture? Can you make a full fist? Here's what I see constantly. People don't lose range of motion overnight. They lose it gradually, and they adapt so smoothly they don't notice the adaptation. You stop reaching for the top shelf. You start using a grabber tool just for convenience. You take the elevator instead of one flight of stairs, telling yourself it's just easier. I want you to try something after this video. Reach both arms straight overhead. Then try touching your palms flat on a table with your arms extended. If one side feels noticeably tighter or more limited than the other, that's information your body is giving you. This is the sign I mentioned at the start, the one that took nearly 2 years to bring my patient Margaret into my office, which I'll tell you about in just a bit. Range of motion loss is sneaky precisely because your brain is so good at problem solving. It finds workarounds so smoothly that by the time you notice, you may have already lost a meaningful amount of function. That's exactly why I want you to actually do the test, not just listen to me describe it. Sign 5. Pain that changes with weather or activity. Your grandmother probably said she could feel a storm coming in her knees. Turns out there may be something to that. Many patients with arthritis report increased stiffness or aching when barometric pressure drops before a storm, though researchers are still studying exactly why the evidence here is genuinely mixed, and I want to be honest about that rather than overstate it. What's more reliably meaningful is pain that follows a pattern with activity. Worse after long periods of standing, worse going downstairs rather than up, or worse after sitting still for a while and then trying to get moving again. Pain that comes with a predictable pattern is different from a random ache patterns. Tell your doctor something specific about which structures are involved. Try keeping a simple notebook for 1 week. Just 3 columns: the activity, the joint, and a pain rating from 1 to 10. You'd be surprised how often patients walk into my office insisting their pain is random, and then we look at their notes together and a clear pattern jumps right off the page: worse every time after gardening, better every time after a short walk. Patterns are gold. Randomness is much harder to treat. Sign 6. Swelling that doesn't fully go down. A little puffiness after a long day on your feet is common. But swelling that's still present the next morning, especially if it's warm to the touch or affects the same joint repeatedly, is your immune system waving a flag. Think of your joint lining like a security team. Its normal job is to protect the joint. In inflammatory types of arthritis, that security team essentially turns against the building it's supposed to protect, causing ongoing inflammation and swelling. That's very different from mechanical wear and tear, and it usually needs a different treatment approach, which is exactly why persistent swelling deserves proper evaluation rather than an ice pack and hoping for the best. A quick way to check. Gently compare both sides. Is one knee, wrist, or knuckle visibly puffier than its matching joint on the other side of your body? Symmetry, or the lack of it, is one of the details doctors pay close attention to, because certain arthritis types have a tendency to show up in matching pairs of joints, while others tend to favor just one side. Sign 7. Unexplained fatigue alongside joint symptoms. This surprises almost everyone. What does tiredness have to do with your knees? Here's the connection. Certain types of arthritis, especially rheumatoid arthritis, are driven by inflammation circulating throughout your whole body, not just sitting quietly in one joint. That inflammation takes energy to sustain, and many patients describe a bone-deep fatigue that regular rest doesn't fully fix, arriving around the same time their joints start acting up. If you've been feeling unusually drained and you've also noticed joint changes, mention both together when you talk to your doctor. Individually, fatigue can mean a dozen different things. Together with joint symptoms, it tells a more specific story. I had a patient once who came in almost apologizing for bringing up her fatigue. "I know tiredness isn't really a medical thing to mention," she said. "It absolutely is." She'd been attributing it to poor sleep for months. Once we connected it to the swelling in her hands that she'd also been quietly ignoring, the full picture came together much faster than either symptom would have revealed on its own. Sign 8. Your shoes are wearing unevenly. This is the one most people never think to check. Flip over your most worn pair of shoes and look at the sole. Is one side wearing down faster than the other? Is the wear pattern noticeably different from a few years ago? Uneven wear can be an early physical clue that you've shifted your weight to protect a hip, knee, or ankle joint without consciously deciding to. Your body is remarkably good at compensating, sometimes so good that you don't notice you're limping until someone else points it out, or until your shoes do. I ask almost every patient with hip or knee complaints to bring in their everyday walking shoes. It sounds unusual, but the sole tells a story your words often can't. Heavier wear on the outer edge of one heel, or a sole worn thin on one side and barely touched on the other, often confirms exactly what an exam is already suggesting. Sign 9. A family history you've never really discussed. Genetics load the gun for a lot of joint conditions. If a parent or sibling has been diagnosed with rheumatoid arthritis, osteoarthritis, or another autoimmune condition, your own risk is meaningfully higher, and it's a detail many patients never think to bring up at appointments because it feels unrelated to how their own body feels right now. If you've never had that conversation with your family, I'd encourage you to. It's a 5-minute phone call that could shape how closely you and your doctor watch for early signs. I've had patients discover, almost by accident, that an aunt or a grandparent had a joint condition that was never openly discussed, sometimes because in earlier generations, chronic pain was simply endured quietly rather than treated. That silence, understandable as it was for its time, can leave today's family members without information that would genuinely help them. Breaking that silence, even decades later, still has value. A patient story. Margaret, I want to share a story with you. This is an illustrative example, not a specific real patient, but it reflects a pattern I've seen many times in practice. Margaret was 67. For almost 2 years, she noticed her knees felt stiff most mornings, sign number 1. But it always loosened up after her coffee, so she didn't think much of it. Then she noticed the grinding sound climbing stairs. Still, she told herself, that's just what happens when you get older. It was her daughter, visiting for the holidays, who noticed Margaret's knee looked slightly swollen and asked when that started. Margaret honestly couldn't remember. It had crept up slowly. She finally saw her doctor, who examined her joints, ordered some imaging and blood work, and diagnosed osteoarthritis in both knees, moderate in severity. Together they built a plan, a physical therapy program focused on strengthening the muscles around her knees, modest changes to her activity routine, an anti-inflammatory approach discussed carefully with her doctor, given her other medications, and a gradual return to walking, starting with short, flat distances and building up over months. I want to be honest with you, Margaret didn't wake up pain-free. There was no miracle. There were setbacks, weeks where the swelling flared, and she wondered if any of it was working. But 6 months later, she was walking her neighborhood loop again, something she'd quietly given up 2 years earlier without even telling her family why. That's not a miracle. That's what consistent informed care looks like. What strikes me most about Margaret's story isn't the outcome, it's the 2 years in between. 2 years of quietly adjusting, quietly avoiding, quietly assuming this was just what getting older felt like. I think about how much of that time she spent limiting her own life based on an assumption nobody ever actually confirmed with her. That's the real cost of ignoring these signs, not just physical, but the small daily narrowing of what you let yourself do. An important safety reminder. Before we get to your action plan, a few things I always tell my patients, and I want to tell you too. Never stop or change a prescribed medication without talking to your healthcare provider first, even if you read something that sounds promising. Some foods, supplements, and over-the-counter pain relievers can interact with medications you may already be taking, including blood thinners and blood pressure medications, so run new additions past your pharmacist or doctor. Every person's health situation is different, and what's true for Margaret may not be the right path for you. And if you ever experience a joint that becomes suddenly hot, severely swollen, or you develop a fever alongside joint pain, that needs prompt medical attention. It can occasionally signal something more urgent than routine arthritis. Tonight's action plan. Here are 5 simple things you can do, starting tonight. 1. Do the reach and touch test I described in sign 5 and take a mental note of any tightness you notice. 2. Flip over your most worn shoes and check the sole for uneven wear. 3. Look at your hands next to an old photo if you have one and compare. 4. If you have a close family member with arthritis, call them this week and ask about their diagnosis and when their symptoms started. 5. Write down anything from this list that applies to you, and bring that list, not just a vague "my knees hurt," to your next doctor's visit. Specifics help your doctor help you faster. I'll leave you with this. Getting older doesn't mean giving up your mobility. It means paying closer attention to the signals your body sends and acting on them while you still have the most options available to you. That's not decline. That's taking care of yourself with the wisdom you've earned. Before you go, how old are you and where are you watching this from tonight? I'd genuinely love to know. And if you've noticed even one of these 9 signs in yourself, tell me which one in the comments. If this video helped you, consider giving it a like and subscribing, because next week I want to talk about something just as important, the everyday habit that quietly protects or quietly damages your joints more than almost anything else you do all day. You'll want to see if you're doing it right.